Pathological gambling is a psychological disorder that consists of repeated episodes of gambling that begin to dominate an individual's life. Many people gamble across the world. There's many different forms of gambling, and gambling's been around for thousands of years. The internet has seen an explosion of gambling worldwide. So since the 90s, when gambling on the internet became very, very big, we've seen an increase in the number of pathological gamblers. So what's the difference between a normal gambler and a pathological gambler? So a normal gambler will go into the casino, they'll have a limit, they'll say, well, I'll take 100 euros, once I've spent, I'm done. A pathological gambler loses all sense of reality when they gamble. It's almost like they're in a trance. So they lose track of time, they lose track of money, they lose track of their surroundings, they lose track of their whole world. And they're just in the moment, in the session, gambling. Most pathological gamblers, it starts off as a very, very innocent exercise. They go to the casino with their friends, or they go horse racing with their work. And they catch the feel for it. They get the excitement, the anticipation when they first put a bet on. It makes no difference really the first time that they have a bet whether they win or lose. That isn't a predictor of whether someone's going to be a pathological gambler. Because often that's not really important to the pathological gambler. It's about it's that feeling when you're in action. Pathological gambling is what we call a process addiction. And one of the things that makes it so addictive is this sense of anticipation with gambling. Much like drugs, gambling affects the reward pathway. Where it differs from drug addiction is this. If you take cocaine, you know what the outcome's going to be. You take the cocaine, you get high. With gambling, there is an extra energy in there. It's called anticipation. So you put the bet on. You may win or you may lose. And that sense of anticipation makes this process more compelling, more compulsive. So you get this high where you'll come up and then you'll either go higher or you'll go lower. And usually for the pathological gambler, they have the anticipation, they have the low or the high, and it's almost always automatically followed by another bet to repeat the process. So it's this sense of anticipation often that makes it so easy to fall into the trap of becoming a pathological gambler. If you think about drugs, you can only take so much cocaine or drink so much alcohol or take so many opiates before your body just gives way. You can't, it collapses or it just gives way. With gambling, the only limit on how long you gamble for is how deep your pockets are. So people can gamble and gamble and gamble. And they will use up all of their money. So often it can lead to financial ruin. It's usually highly secretive. The money lost, people hide it. They hide it from their wives, they hide it from their families. And usually, by the time it comes out, there's been so much dishonesty and so much pain along the way that it ruins people's families. So gambling can destroy families. It destroys families because of the financial aspect of it, through the dishonesty, and also the mood swings of the gambler. If you can imagine the mood swings that they go through, the ups and downs, it's like having your emotions stretched by like an elastic band to almost snapping point. And often when we talk to the family members of gamblers, they will talk to us about the fear that they experienced waiting for the gambler to come home. So they also had this anticipation, but a very, very negative experience. So they didn't know if the family member was going to come in and they'd won, and they would be happy with flowers and gifts, or maybe they lost and they came in angry and created this fearful atmosphere in the house. It can have disastrous impact on the gambler, particularly the time where maybe their problem may be about to be made public and there's nothing they can do about it. There's some research done on suicide attempts amongst pathological gamblers in the United States, and 1 in 5 callers to a helpline had attempted suicide. The symptoms of pathological gambling would include mood swings, preoccupation. They may seem preoccupied with something or not giving their full attention to the important areas of their life. They spend more and more time planning gambling, raising funds to gamble, and gambling itself. So they become restless and irritable when they're not gambling. They may find it difficult to sleep. I've had gamblers that told me that the only time that they can sleep properly is when they've spent all their money. And if they still have money left in their pocket, they're restless because they want to get back out and into the action. At the Kusnacht Practice, the treatment of pathological gambling is tailor-made to each individual, but there are certain core components that we have found very, very useful in the treatment of pathological gamblers. We're very, very keen to identify the underlying causes, and often that is the traumatic events of someone's life or their home life. So we will use psychotherapy to support the client to identify and cope with the trauma. We have found the use of cognitive behavioral therapy for pathological gamblers to be one of the most useful interventions, alongside the BioR program that helps to rebalance the brain chemistry. As I mentioned before, the brain chemistry goes through lots of ups and downs with pathological gambling. So even though you haven't got the detox that's involved with a chemical dependency, you still have this unease, this irritability. So we use the BioR program to support that, cognitive behavioral therapy to deal with the actual gambling process itself, and then psychotherapy to look at the underlying causes. And we also help them to find ways to relax and to look after themselves, self-care, and maybe ways to have some fun without gambling. 12-step fellowships can provide a unique support network for people anywhere they are in the world that they can tap into. People who've experienced the same things as them, if you will, people who speak the same language that they speak. And many of our clients have found developing a relationship with a 12-step group to be a key component in their recovery from addiction. You know, it's very hard to predict the duration of someone's treatment at the Kusnacht Practice. It's a very, very tailor-made and bespoke program. So we take each case on an individual basis. You could generally say that the minimum would be 6 weeks. But you have to bear in mind that we're trying to change often lifetimes of entrenched behaviors. With pathological gambling, this is not an easy process. We're very, very keen for our clients to have support beyond the Kusnacht Practice. Sometimes you could almost say it's quite easy to stop gambling when you're here in the Kusnacht Practice, but the real test is when you return home. So we're very keen for our clients to take a counsellor with them to help them with that transition, and then to have an aftercare or a continuing care program that includes a mixture of psychotherapy and complementary therapies and connection with the support staff that have helped them on their journey. And we like them to come back maybe every 3 months as part of their continuing care program to revitalise their recovery. so they can reflect on what's gone well, what hasn't gone so well, how we can continue to support them, and how they can continue to not just consolidate their recovery, but to be making gains all the time.